Good evening, everyone. Thank you so much for being with us tonight to talk about COVID-19 vaccination for our children ages 5 to 11. Let me just tell you a little bit about the format of tonight's webinar, and then we will go ahead and get started. We have 4 esteemed panelists with us that I'll be introducing shortly. They're going to start off by giving us some information about the COVID-19 vaccinations for our children. Then we have received wonderful questions from all of our registrants, and we're going to provide that opportunity for us to ask those questions. So hopefully all the questions that you have are going to be answered tonight. Tomorrow, you will be receiving from the DCIU information about how to register if you would like to get your child the vaccination, and also some resources that you're able to take some time and get additional information about the vaccine. So hopefully this will answer all the questions that you have, and you will feel very confident in taking whatever next step you choose to take with your child. The other piece that you're going to see visually is as the individual is speaking, they will come prominent in front of the screen. So you might find that when the person is ready to speak, they're just going to take a little breath so that that we can switch between the screens. So we're really excited for you to be here tonight. And without further ado, let me get started to introduce our esteemed panelists. Tonight we have with us Dr. Lisa Mahoney, a pediatrician who also serves as the medical advisor for Delaware County, Pennsylvania. She practiced primary care pediatrics in Delaware County for 36 years and was on the staff at Bryn Mawr Hospital. She has played a vital role in the response to the COVID-19 pandemic in Delaware County and serves on the Delaware County COVID-19 Task Force. She received her medical degree from the Medical College of Philadelphia and completed her pediatric residency at Thomas Jefferson Medical University. Also with us tonight is Dr. Chichi Alonza Maham. She is a pharmacist, CEO, and owner of Springfield Pharmacy. She received her doctorate in pharmacy from Temple University and has been serving Delaware County for over 15 years. She is a trusted provider and leader in supporting children and adolescents during the COVID-19 pandemic, as well as many other families. She has run over 100 vaccine clinics in our region and has been a real key partner with all of Delaware County schools. Also with us this evening is Dr. Craig Shapiro, who is a pediatrician at Nemours Children's Hospital, Division of Infectious Disease. He is board certified with the American Board of Pediatrics in General Pediatrics, as well as infectious disease. He has appeared on various media outlets, lending his expertise on COVID-19 in children. He graduated from State University of New York Health Science Center of Brooklyn and graduated with honors in research and completed his residency in pediatrics at the Children's National Hospital and George Washington University in Washington, D.C. And he did his fellowship in pediatrics infectious disease at Emory University School of Medicine. And our other panelist with us this evening is Dr. June Messam, who's a pediatrician in Wallingford, Pennsylvania, and has over 25 years of experience in the field of pediatrics. Dr. Messam is the owner of Media Pediatrics and is the president-elect of the Delaware County Medical Society. She is also board certified in child abuse pediatrics. She is affiliated with Crozier and the Media Pediatrics. She graduated from Medical College of Pennsylvania and completed her residency at Crozier Medical Center and in affiliation with the Children's Hospital of Philadelphia. I am so excited to hear from our great panelists this evening. Dr. Mahoney, would you please begin and start us off of our webinar this evening?
I would be glad to. Thank you for this opportunity. Good evening, everyone. And I'm really happy to be here to share information about COVID-19 in children. It is difficult for all of us to believe that it has been nearly 21 months since the start of the pandemic. Families with school-age children have been particularly impacted with the stress of remote learning, disruptions of sports and extracurricular activities, and the associated physical, mental, and emotional burdens that developed in our kids. While COVID-19 is often a mild disease in children, I'm here to tell you that since the beginning of the pandemic, among US children 5 to 11 years of age, there have been over 1.9 million cases reported, with over 8,300 hospitalizations and at least 94 COVID-19 associated pediatric deaths. Approximately 1/3 of hospitalized children ages 5 to 11 require ICU admission. Minority children are more likely to be hospitalized due to COVID-19. More Native American, Alaska Native, African American, and Hispanic children ages 5 to 11 required hospitalization from March 2020 to October 2021. Available Delaware County COVID-19 data for cases in the 0 to 4 age group totals 516 cases. And for the 5 to 18 age group, cases total 2,413. But these numbers are likely underestimates because many children have asymptomatic infection, and those children are not necessarily tested. According to the CDC, weekly COVID-19 associated hospitalizations rose nearly 5-fold during late June to August of this year. That was coinciding with the rise in the Delta variant. Hospitalization rates were 10 times higher among unvaccinated than among fully vaccinated adolescents. CDC COVID-Net child hospitalization data from March 2020 to November 2021 indicates a steady increasing trend on the rate of hospitalization due to COVID-19 in children up to age 17. So we're seeing that, certainly this isn't over. Children can have serious complications. So they have been recognized. Complications from COVID-19 in children have been recognized since the beginning of the pandemic. One particular complication is something called multi-system inflammatory syndrome. It's a condition where different body parts become inflamed, including the heart, lungs, brain, skin, eyes, and gastrointestinal organs. And this has been reported in up to 5,217 children since the beginning of the pandemic. 44% of these cases were in children 5 to 11 years old. Like adults, children with underlying conditions such as asthma, diabetes, sickle cell disease, or immunosuppression are also at increased risk for severe illness from COVID-19. Post-COVID conditions also occur in children. It is estimated that 7 to 8% of children with COVID-19 reported continued symptoms of headache, fatigue, trouble concentrating, muscle and joint pain more than 12 weeks after diagnosis. So benefits of vaccine in the pediatric age group will translate to prevention of hospitalizations, multi-system inflammatory syndrome, post-COVID conditions, and death. Further benefits will mean prevention of transmission to vulnerable family members. Vaccinated children will add stability and predictability for working parents, and of course, lower transmission in our schools, adding more confidence in in-person learning. We are all looking forward to the end of this pandemic. Vaccination remains the most powerful tool to get there. Thank you for your time and attention, and I am always available for questions.
Thank you. Dr. Shapiro, can you talk a little bit about the science behind the vaccine, as well as some additional benefits for the vaccine?
Sure, of course. Thank you and good evening. I just wanted to expand upon a little bit what Dr. O'Mahony just said. I think that it's really important that we understand the impact of this pandemic, especially on children. So I want you to remember two numbers, okay? The first is two, the number two. COVID-19 is the second leading cause of death, overall across all age groups over the last 2 months in the United States. And it's the eighth leading cause of death if you look over the last year for the 5 to 11 year age group that we're talking about this evening. So again, significant impact of this pandemic. The other number that I want you to keep in mind is 58,000. Okay, it's estimated by the CDC that if we vaccinate 1 million 5 to 11 year old children, that we can prevent over 58,000 cases of COVID-19 in this age group and over 226 hospitalizations. So it's so crucial that we vaccinate our children to help end this pandemic and to prevent all of the complications of this pandemic that children have faced, and many of which Dr. O'Mahony just mentioned. The Pfizer vaccine, which is the one that I'm going to be speaking about this evening, that's currently authorized for children 5 to 11 years of age and approved for adults, was given emergency use authorization by the Food and Drug Administration, the FDA, in December of 2020 for the prevention of COVID-19 in persons 16 years of age or older. It was then expanded down to 12 years of age in May of 2021, and then most recently down to 5 to 11 years of age in October of this year. It was given approval or full licensure by the FDA in August for people 16 years of age and older. The vaccine is based on mRNA technology. mRNA is a kind of genetic material. It's used by the body to make a copy of the proteins of the virus that cause COVID-19. And that results in a person who receives the vaccine to have their immune system react defensively to the virus that causes COVID-19. So it allows them to be protected from an infection. The one thing that's important to remember about this mRNA technology is that the mRNA is only present in the body for a short period of time. It does not get incorporated into any human cells, and it doesn't alter an individual's genetic material in any way. So it is very safe. And I think that it's really important to understand, I think that in the context of this pandemic, the history of the development of this vaccine has not just occurred over the last year and a half to 2 years. Actually goes back over 30 years and includes hundreds of researchers who have worked on this technology. Actually, the first mRNA vaccines that are very similar to the current vaccines that we now are using in humans were actually tested in animals over 10 years ago, and then shortly after were being used in vaccine trials in humans. So we do have experience with these vaccines that goes far beyond this current pandemic. Now, the COVID-19 vaccine in children went through the same safety testing and was required to meet the same standards as other vaccines, like those for chickenpox or polio, that have been widely given to children for many years and are known to be safe and effective. The trials for this Pfizer vaccine in children from 6 months to 11 years of age actually started this past March. And the phase 3 trials, which I'm going to be talking about, included over 2,000 children that were randomized, meaning that they were either given the vaccine or placebo. The vaccine is different than the adult vaccine in that it includes a third of the dose of the adult vaccine, that's 10 micrograms, whereas the adult dose is 30 micrograms. One of the other differences is that a smaller needle is typically used to administer this vaccine to a child. And the buffer that the vaccine is contained in is slightly different for the 5 to 11-year-olds. And that was mainly due to allow for increased stability of the vaccine, to allow it to be refrigerated at lower temperatures for longer periods of time, higher temperatures for longer periods of time. And that buffer is not a new buffer. It's used in other vaccines that are commonly administered to children. The phase 3 trial for the vaccine followed children out to 3 months. It included over 1,400 children who received the vaccine and over 700 children who received the placebo. And what was found was that there were 3 symptomatic laboratory confirmed cases of COVID in children who received the vaccine and 16 cases in the placebo group, which gave this vaccine an incredible 91% effectiveness in the efficacy in the trial, in the phase 3 trial. Now, recently, I think it's important to note, while we're not talking about the 12 to 16-year-old age group, Pfizer did just release just put out a press release that indicated that the follow-up data for the 12 to 16-year-old age group indicated that there was 100% effectiveness in that age group for the same vaccine, which is completely remarkable. The fact that these vaccines can actually completely prevent, in some cases, infection and prevent transmission of this virus. Now, the way that the studies were done, the reason that we were able to get them done in a smaller group of children as opposed to the large groups of adults is that we used some of the data that came out of the adults vaccine trials to compare the immune response in children to make sure that we had an effective dose of the vaccine that was comparable to the dose that was being given in adults. In terms of adverse effects, it was found that over the 3 months and looking at over 3,000 children, that the vaccine was very safe. There were only 2.7% of the vaccine group who had a reaction, and these were all local reactions. There were a few systemic reactions, mainly fatigue and headache being the most common. The most common local reaction was pain at the injection site. There were no serious adverse effects that were found in the vaccine trial. And so again, this vaccine is exceedingly safe, exceedingly effective, and can really impact the pandemic in our children. So I do want to end by saying that I'm speaking to you tonight as not only a pediatric infectious disease physician, but as a parent. And I can tell you personally, how relieved I was that my 6-year-old and 9-year-olds were able to receive their second dose of the vaccine just last week. And coming home every day from the hospital and thinking about whether or not I'm exposing my children to this virus. It's just so reassuring to know that now my children are vaccinated. So thank you. And again, I'm happy to answer any questions.
Thank you, Dr. Shapiro. Next, we're going to hear from Dr. Maha, and she is going to talk to us about how do you prepare your child for the COVID-19 vaccine administration.
Thank you. Thank you, everyone, for being here. First of all, I would like to thank Dr. Shapiro and Dr. O'Mahony for the insightful information that they shared with us about the vaccine being safe and effective, because that's one of the biggest questions that we get from parents who, yes, most of them got vaccinated, but they're very afraid for their babies. And I do understand, just like Dr. Shapiro shared, I am a mom as well, a mom of 2 young children under the ages of 11. And I will tell you that once the CDC approved for us to start vaccinating, the first 30 people that walked into the pharmacy to get vaccinated, to get their children vaccinated, were all physicians. Majority of them were pediatricians. So that also gave me more assurance that they know science and they are pediatricians that we trust every day for our babies. And if they're the first ones in the store to get their babies vaccinated, then we are all in safe hands, right? And some of the things that we've seen so far, I mean, back at the beginning of the year when the vaccines were rolled out and we started giving out vaccines, we also noticed that a lot of people were afraid to come forward for vaccines, not only because they were afraid, but because of access. They didn't have access to the vaccine. That's why we were able to partner up with local leaders, especially the DCIU, to help these parents meet them where their children are. So it doesn't matter if you have a car or if you don't have access to find a place to get a vaccine. We were able to come to the schools, and we did a tour of all the schools in Delaware County, and we're still on tour till date. And we also reached a lot of underserved populations. There are a lot of people in Delaware County that don't have insurance or underinsured, or maybe are Medicaid, and they're not sure if they qualify for this vaccine or not. The good thing about our government is they said if anybody is on the soils of the United States, it could be a tourist, you have access and should receive the vaccine. And now we're dealing with the 5 to 11-year-old population. The good news is that these kids, I mean, we started the second dose since last week. They have lesser side effect profile than the adults. I always say the babies are stronger than their parents, not just physically, but also emotionally. And we've also noticed that parents are projecting their fears on their children. And what we say at home really matters. I remember when my family members get their vaccines, they're like, oh, I was knocked out for 24 hours. The children are hearing these things that we're saying. And because they don't understand the science, they don't understand this pandemic, and all we're hearing is the amount of people dying from COVID, and they don't understand what it means, what an mRNA vaccine means. So what we say around children to get them prepared to come for their vaccine is very important. Just like when we go to the pediatrician to get our routine vaccines, whether it's measles or polio or anything that is due for their milestone, we get them excited about it. We offer treats. We talk about having ice cream for dinner, whatever it is, just to calm their fears down. I encourage parents and I encourage caregivers to do the same when it comes to the COVID-19 vaccine. And I'm going to share a little bit of a story about a little girl that will not let anybody touch her because she was afraid that we are putting the COVID virus in her because her mom said, you're going to get the COVID vaccine. Maybe mommy should have said, you're going to get the vaccine to prevent you from getting sick from the COVID virus. So the 5-year-old could not separate the difference between how can you say I should stay maxed up so I don't get COVID-19, and now you're telling me that I'm going to get COVID-19 vaccine. So the languages that we use around the house and what we say to the kids on their way to get the vaccine really, really matters. Some parents go Band-Aid shopping so they can get the kids' favorite Band-Aids before they show up to clinic. Some kids wear their favorite superhero costume. I've worn superhero costume, whatever it takes to get the children more comfortable and more relaxed. And they ask us questions before the vaccine. Does it hurt? I don't lie to kids because if I tell them it doesn't hurt, that means they won't come back for the second one. So I say things like, it's very fast. It's very quick. This is good for you. Trust your parents, right? And yes, we do offer treats. We do offer lollipops or hot chocolate or ice cream. And then a lot of parents are also very concerned about, my child carries an EpiPen. What should we do? And the CDC does recommend that anybody that gets the vaccine should wait for 15 minutes for observation. And for anyone that does have allergic reactions, not necessarily side effects, but allergic reactions where you carry EpiPen, you have to wait for at least 30 minutes for observation. And from my experiences, not only for this 5 to 11 age group, but we've done over 45,000 COVID vaccine doses in Delaware County. And people do come back for their second shot, even children. So the mRNA vaccine is very safe and is effective, like Dr. Shapiro pointed earlier, And most side effects that we notice are localized, especially when the kids tense up, their muscles do tend to hurt. So we try to get them to breathe or sing or watch whatever we have on SpongeBob, whatever it is the kids are watching nowadays, just to bring the anxiety down. And so far, I'm telling you from experience, I prefer vaccinating younger children than adults. Thank you for having me.
Thank you so much. Now we're going to hear from Dr. Messam, and she's going to talk a little bit about what a parent or a child might expect after they get the vaccine.
Hello, everyone. Good night. Thank you so much for having us tonight. And actually, you're going to hear some repetition of what you've heard. So I think that it's so wonderful that so many of you have such great questions. And I hope that you feel comfortable reaching out to any of us and to ask your questions so that we can get through this pandemic. As a cancer survivor and a pediatrician, I'm excited to have another layer of protection for myself, for my family, for my patients. So full disclosure, I've received 3 doses of the Pfizer vaccine. And other than pain at the site of the vaccine, which resolved with Tylenol and Motrin, I had no other issues. Everyone in my immediate family is also vaccinated and have not had any significant reactions. And as a physician, I could not wait for them to approve for the younger kids so that I could make sure. And after I got my son vaccinated, the youngest one, I came home, went upstairs and bawled my eyes out because I thought, okay, now we're going to be okay, right? The fact is that the majority of children getting the COVID vaccine have little to no outward physical reaction. So I've done a couple COVID immunization clinics and I try to make it fun. We had balloon twisters and we had forearm painters present at ours, and the kids couldn't wait to get their shots done so they can just go get their favorite balloon thing and get their arm painted. I had been so stressed before it. And then I heard all this movement in the second room. So I went running over to see what they were doing. What was the noise? The kids were in the middle of the room, like with their balloon swords, playing and laughing after their COVID vaccine. So when I tell you that it's well tolerated, it is well tolerated. I'll discuss the most common reactions with you by placing them in 2 categories. Local reactions, meaning reactions at the site on the body where we place the vaccine locally, and systemic reactions, meaning things that occur throughout the rest of your body. If your child is going to be one who gets a local reaction, and honestly, they might not have any reaction, but if they're going to have a local reaction, the most common reactions are the pain at the site of the shot, redness, and perhaps swelling at the site of the vaccine. These are really easily treated. You can put some ice on them, a cool wet rag. And these are no different from the other vaccines that they receive. These are the same local side effects that children tend to get. We usually ask the child which is their dominant arm. What arm do you write with? And we put the vaccine into the other arm in case they get achy, in case they have a reaction to the vaccine. The common systemic reactions that occur include, as you've heard already, tiredness, headaches, muscle aches, joint aches, pains, chills, fevers, and nausea. If these occur, they typically last 1 to 3 days and frequently occur after the second dose of the vaccine. Many patients wonder why the reactions may worsen after the second dose of the vaccine. Well, that's because your immune system now recognizes the virus after the first dose of the vaccine, and it mounts a stronger immune response. Even though it doesn't feel good, it's a good indication that the vaccine is doing its intended job. There are concerns about the risk of anaphylaxis after the COVID vaccine. generally, with any vaccine, we expect that 1 patient in a million will have a serious adverse event. Well, with the COVID vaccine, for every million doses of vaccine that's given, we expect maybe 2.5, depending on the sources, to 11 patients will have a serious adverse event. That's in every million. 1 million doses of vaccine that is given. So think of it, 1 million and 2.5 to 11 patients. How likely is your child to have an adverse event? Very unlikely. So if you're going to have an adverse event, it typically happens 15 to 30 minutes after the vaccine. And this is exactly why we have the wait period after the vaccine. I want you to know that the components of the vaccine are safe. It's already discussed. They include mRNA, they include fats, sugars, and a buffer that is used in many other medicines, including insulin for diabetic patients, Toradol if you've had surgery. There are no fetal cells, no animal products, no eggs, no milk, no peanuts, no other nuts, no latex. So even if you have allergies to these things, the COVID vaccine is safe for you. The risk of a serious adverse event is very rare, and in stark contrast to the death and the disability that is caused by an actual COVID infection. In short, the benefits of the COVID vaccine outweigh its known and potential risks. I join my colleagues today to urge you to vaccinate your children. And if you do not yourself have the vaccine, please consider doing so. Like you, we as physicians are looking forward to the end of this pandemic. Thank you so much for allowing us to have this conversation with you tonight.
Thank you. I was wondering if anything came to mind as one of the other panelists was talking, that anybody would like to have any follow-up comments before we get to the questions that many of our registrants would like to know about.
I would love to add, as a pediatrician, that just to emphasize that children feed off of our energy. If we're anxious and we're terrified that something terrible is going to happen, and we transfer that to our kids, they are terrified. They're not only terrified that we're going to put COVID into their body, they're terrified about all the other things they hear us talking about. So if you come with a positive attitude, the kids will do so much better.
Thank you. I am going to ask Dr. Shapiro to answer some of our questions that we have our registrants asking. And I'm going to give 2 right up front, and then we can kind of go into others. But we've gotten some questions around, my child is 11, and they're going to turn 12 in 6 months. Should I wait? Also, there is questions around, if my child is small for the age of 12, should we be giving the vaccine of what we might give to somebody who is 11? I was wondering if you can talk a little bit about both of those.
Sure. So in terms of waiting until their child turns 12, as Dr. O'Mahony mentioned, we're seeing many cases right now, and I can speak to my own experience in the hospital. We still are seeing children hospitalized from COVID. And so, any day that you wait when you have the ability to vaccinate your child is a day that they could become infected. We know that this, as I just mentioned, and the other panelists mentioned, these vaccines are extremely effective. And the doses are really, I think this is the key to those questions. The way that these vaccines were developed and the way that all vaccines are developed are based on age, not based on weight. So it doesn't matter how big or small your child is, it's the age that really dictates the response of the immune system to the vaccine. And so if your child is 11 years of age, we know based on these trials that they will respond just as well as a 12-year-old would to the higher dose, getting the lower dose of the vaccine. And that the 12-year-old will have a very good response to the larger dose of the vaccine. So there's no reason to wait to get your child vaccinated. If anything, you should vaccinate, as soon as you have the opportunity to do so. But when your child if they do turn 12 and they've gotten their first dose of the lower dose, the CDC does recommend getting the higher dose of the vaccine once they turn 12, because that was what was studied. And we know that that's what's going to protect those children at that age from the virus.
We also had questions around if my child had COVID, how long do I need to wait? There's been, I think, a lot of information out there and we hear different things. What is the recommendation?
Sure. So there is no specific recommendation as to the timing of the vaccination after someone has been infected, with one caveat being that person needs to be outside of their quarantine or isolation period once they've been infected, so that they're no longer potentially exposing anyone around them when they go to get the vaccine. So it needs to be at least 10 days from when they began their symptoms or when their positive test result was, and they should be showing signs of improvement. If they are having symptoms, we want to know that they are getting better from their infection. But once that time occurs, that child can be vaccinated going forward at any time. We don't know yet what the optimal time is to vaccinate, but we do know that people who have been infected will not have immunity to the vaccine for a long period of time. So we do encourage that once you are outside of that infectious period, that you receive the vaccine, as soon as you are able to get it.
And if you had a crystal ball, do you think that children ages 5 to 11 are also going to need a booster shot?
Yeah, so
I'm getting a lot of questions on that.
Yeah, so I think that's the million-dollar question right now. We don't have any data. I'm a science guy, and we don't have any data really to make that declaration just yet. For that, of course, like the adult vaccines, these children in the trials and children who have been vaccinated since it has been authorized over the last few weeks will continue to be followed for months, and we will do the same studies that we did with the older children and adults to see if those antibodies that are produced wane over time. I think that if I had to venture a guess, one thing I would say is that children's immune responses, and kind of to the point I was making earlier, children's immune responses are different than adults. We know this from other diseases, from other vaccines for diseases, that adults don't mount as strong of an immune response and that immune response usually doesn't last as long over time. So I wouldn't be surprised if children don't need a booster dose, and if they do need a booster dose, it might be much longer or much later than it is currently recommended for adults now 18 years and older, who should be getting their booster doses 6 months after their second dose. So I'm optimistic. And the other thing is that we know that, again, children, while they do get infected, seem to not develop as severe of infections as adults do. So the 2-dose series that's currently recommended may be enough for younger children to prevent serious complications. And so yeah, I'm very optimistic that hopefully children will not need boosters, but we'll find that out over the next year.
Thank you so much. I have a couple questions for Dr. Mahoney, and I'm going to start off with, we're getting questions of whether or not you can do both the COVID vaccine and the flu vaccine either together or in close proximity.
Yeah, so now it is recommended to get your vaccines. If you need to get a flu vaccine and a COVID vaccine, that certainly can be given together. It makes it more convenient for parents to double up like this. And there is data that says that often you get a better antibody response when you get more than one vaccine at a time. And certainly when your kids were 2 months, 4 months, 6 months, when they were tiny babies, they were getting multiple injections at the same time. So we know that vaccine really is a teardrop in the ocean of antigens and foreign things that people encounter every day. So we know that you can encounter both a flu vaccine and a COVID vaccine on the same day and handle it very well.
Great. I know that we're just learning information on the new variant. Do you have any information that you could share or how this new variant might be playing out in some of our younger children?
I think this is really way too early to tell. I think the thing to consider is the Delta variant is the dominant strain in our area. I think there will be close surveillance and all the genomic sequencing will be happening around us to learn about Omicron. I think our best defense against any of the variants is to use the vaccines that we currently have. And experience with flu vaccine year to year, when we don't get a perfect match, we know that it still confers protection to a certain extent. It may not be as robust as with other variants, but certainly your best defense is to use the vaccines that are currently available, and the likelihood is that you would dampen your infection and your illness.
We've gotten several questions. If you, again, had a crystal ball, do you think that the COVID-19 vaccine is going to be mandated as one of those vaccines for children to go to school?
I think that the COVID vaccine will be strongly recommended and not mandated. And certainly private schools may be able to be more stringent than the public schools. However, I don't really foresee a mandate, but just strongly encouraged.
And I know that you have done so much work around the COVID-19 pandemic on the task force. How can you help our families know exactly where to go or where to find information if they're interested in the COVID-19 vaccine for their child?
So we can send all of the participants, all the registrants in this webinar, an email that will include the vaccine sites that we have in Delaware County, both in Yeadon and in Chester. We have a call center that's open 5 days a week from 8:30 to 4:30. We can help you with that. And there will be other information just on how to find a very convenient and local vaccine site as well. So all of our registrants should look forward to some email that will give them that information.
And we've also had some questions about fertility and the COVID-19 vaccine. Does it cause a child to become sterile? Could you talk a little bit about if there's any link or correlation between the COVID-19 and fertility?
Yeah, that question comes up, and the answer is no. There is no evidence that any vaccines, including the COVID-19 vaccines, cause female or male fertility problems. There's no evidence that vaccine ingredients or the antibodies that are developed during COVID vaccination will cause any problems with becoming pregnant. Similarly, there's no evidence that the COVID-19 vaccine affects puberty. It's recommended before and during pregnancy to protect the mother and the developing baby. And I think that we certainly know that COVID infection in pregnancy can be devastating, both for the mother and the baby. The studies show that the COVID spike protein that you develop during natural infection or after vaccination does not cause any issue with fertility. So we have a lot of experience with vaccine, but also we have a great understanding of this mRNA vaccine, and there is ample evidence and reason to believe, like any other vaccine, it does not interfere with fertility or puberty.
Thank you so much. I think we're going to ask Dr. Maha to help us out with the next series of questions. And in full disclosure, she gave me my vaccine and it was very easy and no pain. So I thank you for that. But one of the things that we have been asked is there a difference for concerns for boys and girls with the vaccine? Is there any difference based on gender?
I've heard this before. It's a lot of parents have brought it up to us a lot of times, and it is extremely rare. But actually, it's the reverse, because a lot of people have more concerns for girls than boys. And some of the studies that I've read, because I read a lot every day because of all these questions that keep coming through at the pharmacy, some of them show, which Dr. June will talk about shortly, about myocarditis and pericarditis, was seen more in boys than girls. However, although the risk is very, very low for this age group, there are no concerns at all for whether it's a girl or a boy. The side effect profile is the same, it's similar, it's mostly just localized, just a little pinch, and the kids feel like their arms are sore. But just like we know, children can have a very high fever and still be jumping and bouncing off the walls. So the side effect profile for this, especially like Dr. Shapiro said, the dose is very, very, very small. And so far, everybody has been doing great. And there's no data out there that shows that boys versus girls or boys versus girls have higher concerns.
We've also had some questions of what if my child has a food allergy? How are children with allergies responding and tolerating this vaccine?
I love this question because my daughter has severe food allergies, peanuts, tree nuts, sunflower seeds, sesame seeds, name it, she has it. So she carries EpiPen everywhere she goes. So one of the questions we always ask parents, like I said earlier, is, does your child have any allergies that requires an EpiPen? And the only reported allergy to most vaccines, especially this Pfizer vaccine for the pediatrics, is the polyethylene glycol. And it's very little in this vaccine. And I don't personally know anyone that has a polyethylene glycol allergy. And it's in a lot of things. Canned food, it's in so many things that we could not even think about. Normal things that we eat, normal snacks that we eat, normal baking items that we use. But if you have an allergy to anything at all that requires an EpiPen, you are required to wait for half an hour, at least half an hour for observation. And so far, we have not seen any, and we've given out 10,000 pediatric dose in the last 4 weeks for ages 5 to 11, and we haven't seen anything yet.
Thank you. And then, one of the questions that has also come up is, you talked a little bit about it, Dr. Messam talked a little bit about some of the side effects that you might face. Is there any difference between side effects that you might see in younger children versus your adolescent, your 12-year-old, 13-year-old, 14-year-old?
So far, we've seen a lot more side effects listed here, and the older kids, 12 years and up, most of them just resolve itself within 24 hours. Moving beyond the local site pain and maybe feel a little fatigue, a little tired, a little bit of a headache, but we haven't seen anything like that in the younger babies, ages 5 to 11.
Thank you so much. I'm going to ask, I have a next series of questions for Dr. Messam. Good evening again. I think Dr. Maham talked a little bit that you were going to talk about myocarditis. I don't even know if I'm pronouncing that correctly. And there was a lot of information that had come out, and of course this was with the older population. Can you talk a little bit about this in children 5 to 11?
I'm delighted to. And so, the medical community is under so much scrutiny right now, and we're throwing around these words, myocarditis, pericarditis. And basically what people are hearing is, oh my gosh, I'm going to give my child this shot and kill their heart. Right? And so that's just absolutely not true. Myocarditis has been around forever. Myocarditis is an inflammation of the heart, and pericarditis is an inflammation of the sac around the heart. And so I'm just going to put this out there and I'm going to discuss it a little bit. For every 1 million patients, and clearly I like numbers, for every 1 million patients vaccinated, we expect about 4.5 cases of post-vaccine myocarditis, right? That is little to none. Not for the people who have it, but when you think about the amount of people you have to vaccinate to get 4 cases, it's a huge amount. So if we back up for a minute, forget vaccines for a minute, the incidence of myocarditis in children in general is 1 per 100,000, right? It can be caused by numerous viruses, bacteria, parasites, fungal infections, alcohol toxicity, hypersensitivity reactions. You can have it as a reaction to amoxicillin, which we give all the time, right? For ear infections and other things. So despite the fact that it exists, it's quite rare in children. So I want to put this in perspective. In the high-risk age group for developing myocarditis is in puberty. So about 16 to kids in their 20s. And it's twice as frequent in males than females. So just as Dr. Chichi was just saying, this is the one area where there's a little bit difference. It's higher in males than females. So where I'm getting all my numbers from that I'm about to give you, from the New England Journal of Medicine, from JAMA, from the Morbidity and Mortality Weekly Reviews, and from our children's hospitals around the nation. Right? Since the risk is higher for males than females in the 16 to 29-year-old age group, I'm going to talk about a population of 100,000 males in this age group between 16 to 29. Let's say that none of these 100,000 people are vaccinated. We would expect 960 of them to get the COVID infection. 30 of these infections they would be hospitalized for. 6 of these, they would end up in the intensive care unit, and 59 of them would get myocarditis from the COVID-19 virus. This is in the unvaccinated group. So let's say we immunize this entire population of 100,000 males in this high-risk group. We would expect 5 of them to get myocarditis from the vaccine. When you compare the morbidity and that you get from the actual virus, it is nothing compared to what you get from the vaccine. Let's just very briefly look at females in the same group. Females 16 to 29. You take an unvaccinated group of 100,000 girls, 1,280 of them would get COVID, 75 of them would be hospitalized, 5 would be in the intensive care unit, and 39 of them would get myocarditis from the actual COVID infection. If we immunize this entire population of young women, we would expect 1 of them to get myocarditis after the vaccine. So I would say that I would choose getting the vaccine any day over getting the actual COVID. The worst case scenario, let's say your child is vaccinated and a few days later they suddenly have chest pain, shortness of breath, their heart is racing. Please call your doctor. They'll ask you a number of questions. You disclose to them that your child had the COVID vaccine. They would order some tests. They would do an EKG. They would do an echo. You should know that the myocarditis that is a result of the vaccine is easily treated. and quickly resolves.
And are there any other concerns that you've heard as a pediatrician of fears from parents of side effects or long-term effects of the vaccine?
Absolutely. Every single day I hear in the office, but we don't know what's going to happen 10 years from now. That's true. We don't, but we want them to live to figure it out. And there's no guarantee. I always tell them, I don't have a crystal ball. So if I knew that if my son got it, he would live, and then my older son got it, something bad would happen. Okay, then I'll immunize my older son first. But we don't have crystal balls. The fact is that many kids and many adults succumbing to this virus are really healthy, right? I had a parent ask me, if I get if I give my child the vaccine, their caregiver is immunocompromised, aren't they going to give the virus to that caregiver? And no, they're not. They will not, because we're not infecting their bodies with COVID. So there is no way after the vaccine for you to give COVID to someone else.
Thank you so much. That was very informative. I want to go back to Dr. Shapiro because there's some other questions that really deal with the immune system, and maybe you can help us out. What is the difference between natural immunity from getting the COVID-19 virus versus having the COVID-19 vaccine? Is there a difference? Are they both the same? If you've had COVID, you have the antibodies, it's just as good as getting a vaccine? Would you be able to help shed some light on the differences? And, is having COVID, you just have the antibodies and it's just as good?
Yeah, that's a really important question. So thank you for bringing that up. So first of all, clearly the answer to that is no. The immune response to natural infection is not the same as the immune response to the vaccine. We know that prior infection can result in protection against infection, but it's not 100%, and it likely decreases over time. And so we don't know yet, how long or who is, likely to be protected. There's really not a good way right now to know that. We know that, people who have more severe disease seem to be better protected, have more of an immune response than people who have mild or asymptomatic disease, which many children tend to have. So we don't know if children are going to be as protected as adults who have more severe disease. And as I mentioned, a child's immune response is very different than an adult's immune response. And one of the things that has recently been shown in some laboratory studies is that the immune response in children to natural disease is very different than in the adults, and that they don't produce the same type of immune response. They don't have the long-term protective immune response that many adults have. So that might open up children to being at greater risk of developing multiple infections over time. So that's very concerning. There were two very important studies that were recently published by the CDC that I just want to highlight. Both of them were adults, studies of adults. One was in Kentucky with over 7,000. I'm sorry, the one in Kentucky was a few thousand people. And what it showed was that those that were unvaccinated and were more likely, at least twice as likely, to develop reinfection from COVID-19 after having been infected compared to people who had been infected previously but were subsequently fully vaccinated. Okay, so we know that being vaccinated is at least twice the amount of affords twice the amount of protection as natural infection does. There was another study, multi-state study with over 7,000 hospitalized adults recently that showed that those who were previously infected in the past 3 to 6 months but unvaccinated were over 5 times more likely to be infected again than those who had received 2 doses of the Pfizer or Moderna vaccines and had not been previously infected. So again, vaccination is so important regardless of whether you've been infected previously. You need to be vaccinated to afford long-term protection and prevent reinfections.
There is also one of the registrants asked the question is, my child gets their first shot, then they get COVID. Should they even get a second shot if that occurs? And if so, would it still be that 10-day period, 14-day period from the quarantine isolation up till that period is ending?
Yeah, that's another great question. So currently, yes, the recommendation is that they should finish their full series. The series for that age group is the 2 doses, 21 days apart. It can be spaced out to 42 days in a situation like this, where you may need to extend it if that child has been infected in between and you're not outside that 10-day period. It is okay to go out to 42 days. But the recommendation, as I just mentioned, because we know that those 2 doses, regardless of whether the child's been infected or not, is really important to provide that protective immunity. Currently, the recommendation is still that they should finish their full series and get that second dose. Over time, again, this is going to be studied whether people who have had prior infections, whether they mount as good of a response with 1 additional dose. That I think is still, we're still waiting to see some of that data. But yes, even if you've been infected in between the first and second dose, your child still should receive that second dose once it is safe for them to do so.
Thank you so much. At this time, I'm just going to call on each of the panelists for some closing remarks. And if one panelist could at least talk a little bit about, if my child gets a shot, one of the first shots here in Delaware County, but we know we're moving in a week, can I just go to another state to go ahead and get the next shot? So I have a feeling this is right down Dr. Maha's lane. I'm going to ask her to answer that question, and then any closing remarks you'd like to make.
Sure, thank you. We've got a lot of those kind of scenarios where we gave a first shot and the families moving to California, for example. It's not a problem. Just show your vaccine card when you get to the next stop, I'll call it, and make sure you get your second shot within 21 days. And like Dr. Shapiro said, in between travel, we understand things happen, and you have up to 42 days to get the second shot. We've also had families that moved into Pennsylvania from another state or another country. And as long as it is the Pfizer vaccine that they got as a first shot, because it's US approved, FDA approved vaccine for this age group, we do administer the second vaccine here in the United States to complete the series, because it's very important to complete the series. For closing remarks, I am encouraging everyone, not only as a clinical pharmacist, but also as a mother, and also as a daughter to elderly parents, that getting the vaccine for our children is very important to keep them active in school, because last year was very rough, not only on parents and the teachers, but also on these children, and socially and mentally and physically. Children belong outside. They need to be outside to help them grow and mature nicely, and getting the vaccine will help us reach herd immunity, keep our children safe. And I don't know what COVID will do to a baby body and growth long-term, but I know what the mRNA vaccine will do to their body and health because of science. And it's not a risk I'm willing to take as a mother, as a pharmacist, as an auntie, as a daughter. It is better to get our children vaccinated as soon as possible so that we can all reach this herd immunity and be safe. Thank you.
Thank you so much. Dr. O'Mahony, would you like to provide some wisdom of closing remarks?
Sure. I want to thank everybody for their time and attention. I think the important part is that, COVID-19 in children can be mild. Children can be asymptomatic. And, the percentage of kids who are hospitalized is relatively low. I think the critical piece is that in order to, really change the course of this pandemic, more people need to get vaccinated so that our children are not reservoirs to this virus. In other words, they are hospitable to this virus as long as they are not vaccinated. And I like to think about sort of a soundbite like COVID has no home here. I can remember traveling or as a pediatrician practicing where we had N95s, another mask, goggles, shield, and we didn't have a vaccine. So we had to kind of really armor up. We have armor now. We have safe, effective vaccines. We can make sure that our children are not hosts to this virus. And critically, as long as we have hosts, individuals who can harbor the virus, we have that potential for mutations to occur. And this is why the more people that get vaccinated, the fewer people that are hosts to this virus, the more people who are saying COVID has no home here, the quicker we'll get out of this pandemic. So I really thank everybody for listening. And certainly if you have continued questions, we will always be available to talk even one-on-one, because sometimes it really takes individual conversations. So don't hesitate to reach out.
Thank you so much. Dr. Messam, what wisdom would you like to continue to help us to work with our families to give them the confidence to take this next step?
I think that you need to have a relationship, a good relationship with your doctor. If you trust your doctor and your doctor has been guiding you and taking care of your child all along, you call them when you're afraid. Why on earth would we lie to you and do something that we think is dangerous, something that we're doing with our own children? I think that I understand anxiety, I understand worry, I understand that the social media is really taken a really dark turn with so many different things. And I just want to say, please rely on the people who spent their life studying medicine. My entire life is about protecting kids, is about making things better for children. And you're just like Dr. O'Mahony said, even though your child may not get very ill from it, they harbor the virus and they spread it. And I cannot tell you the sadness that we've experienced over these last 21 months, where, I get phone calls every day. I have to cancel my appointment. My mom died from COVID. My grandmom died. Like, there are people who live in multi-generational families in the same home. That's what they have to do. And if we expose those children and others to this virus and they take it home to their elderly and or ill family members, sometimes they die. Quite a bit of them have died. I'm tired of the deaths from COVID. I'm tired of being afraid. I am not the only cancer survivor. I do not want this virus in me. Yet we never shut our doors down. We kept on being there to help our patients. Please help us to help you. Please vaccinate. Thank you so much for your wonderful questions. Thank you for letting us have this webinar, and please reach out if you have questions.
Thank you. And Dr. Shapiro, some closing comments, and also being with the Children's Hospital, I am sure you've seen some of the most challenging cases and really have promoted vaccine in children. And as you said, your own children, you feel so much more at ease now that they're vaccinated. What closing comments would you like to give our audience?
Yeah, thank you. First of all, I want to thank all the participants and the DCIU for this opportunity to talk to all of you tonight. I mean, as all the panelists have said, we we want to protect our children. You know, every child that I have taken care of, unfortunately had to take care of in the hospital. And I have that unique perspective, at least over the last few months, has not needed to be there. Okay, most of these are teenagers who have had the opportunity to be vaccinated since May. And it is unfortunate that, you know, their parents have chosen not to vaccinate them, because by the time they get to see me, you know, we really are dealing with, you know, time and, you know, the impact of this virus on that child's body. There really aren't many tools that we have available to alter that, you know, that ongoing impact that the virus has had by the time they show up in the hospital. So prevention is by far the most effective tool that we have, you know, as all the panelists said, to put an end to this pandemic. And so that is why it is so important that we, you know, that we get our children vaccinated. It's so important because there's no reason that anybody needs to be impacted by this virus, whether it be personally or, you know, by, you know, through colleagues or friends. It's just incredible. We are so fortunate to live in a country where we can literally walk down the street and receive a vaccine that is so effective, as we all mentioned, and so safe. And we really need to take advantage of that. So thank you all.
Thank you. I hope this webinar was informative for all of our audience. We have some great panelists with incredible knowledge and expertise. And if there's one thing hopefully you're walking away from is how important the COVID-19 vaccine is for your child, as well as it is safe. As a reminder, tomorrow, all of our registrants will get more information about where they can sign up to get a COVID-19 vaccine, as well as the ability to listen to this webinar again. Have a wonderful holiday season. Thank you for joining us. Please be safe and stay healthy. Have a good evening.